COVID mandates are making a comeback. Rutgers University in New Jersey is requiring students to wear masks and be vaccinated in order to attend classes. Some California and New York hospitals are also bringing back masks, and even Hollywood studio Lionsgate is telling workers to cover up. But is this really necessary? Let's bring in campus Reform Correspondent and Rutgers University student Jeremy Li and Fox News medical contributor Dr. Jeanette Neshwat. Good morning to you both. Dr. Neshwat, I'll start with you. What do you think about this? At this point, is there any reason to have mandates?
Absolutely not, Carly. I think it's illogical to mandate something that's ineffective. You know, what they're asking are these young, healthy college students who are low risk to mask up and to live like a hermit, to social distance and to avoid, large gatherings and parties. But I can tell you firsthand, having taken care of thousands of COVID patients, these little flimsy surgical masks, they're ineffective. Now, if you choose to wear a mask and if you're in a high-risk group, that's one thing, and you probably want to wear an N95 mask. But to mandate masks, to mandate vaccines at this point, I think is the wrong move. To shut down schools, to have remote learning, absolutely breaks my heart. I can tell you my last shift, I saw about 55 patients, had about 8 or 9 who tested positive for COVID. All of them, their symptoms were mild, sniffles, cough, sore throat, that sort of thing. But they did very well. And it's important to remember, Carly, we now have the tools to treat COVID. Yeah. It's not like where we were 3 years ago.
Yeah, that's a great point. Jeremy, what's going on at Rutgers? Masks and vaccine mandates, really?
Yeah, believe it or not, we still have a vaccine mandate on campus. And I absolutely agree with the doctor right here. It's just devastating to see that we still have schools across, all 3 of our campuses having this vaccine mandate in place, but also having, mask requirements in place for a lot of different facilities. And, I agree. I think students are really fed up with the fact that despite the fact that majority of staff and students have been vaccinated already or have some sort of immunity from potentially contracting it, and it doesn't make sense to put college students into dorms, isolate them, when the reality is that college is supposed to be a social experience for all of us at the end of the day. And at the end of the day, we need to start thinking about whether or not students really want to go back to wearing masks and, hunkering down, when the reality is that people just want to live our lives at the end of the day.
Dr. Neshwat, there are 2 new strands of COVID. I think that's why this is all happening. What do we need to know about these 2 new strands?
Yeah, and I think that's the concern. We have the EG5 and the BAX, and the concern is that there's about 30 genetically distinct mutations. And so the concern is, okay, maybe this type of COVID strain will evade or escape our natural immunity or our vaccine immunity. But what I think is happening is the fact that we are trying to interfere with Mother Nature. It's normal for viruses to mutate. They have been mutating since the original strain, since Delta, since the first Omicron strain. We expect that to happen. We're going to see more mutations and we're going to see more variants. But what we need to do is continue to live our lives, because many of us have natural immunity, vaccine immunity, or a combination of both. And like I said earlier, Carly, we have the tools to treat. I think we need to stay focused on the most vulnerable groups, the high-risk groups. That's our senior citizens, those with underlying medical conditions, weak immune systems, heart disease, obesity, lung disease, that sort of thing.
Yeah, and Jeremy, quickly back to you. I think the fact that you're getting forced to get vaccinated at this point, 3 years later, is a bridge too far for a lot of people. So what are you personally going to do? And also, how is Rutgers on exemptions?
Rutgers has definitely been very strict on exemptions. I know some friends of mine that personally have a lot of challenges trying to get those exemptions in the first place. And it's a struggle that they've had before many, many times. And every single year this happens, where they really insist that they really don't have any religious reason for an exemption. But the reality is that people do. Yeah. And this is not, something that people should be forced to do at the end of the day. This is about your body and whether or not you want to put something that you don't believe in putting in your body, being put in your body. As for me personally, I am vaccinated. I believe in the effectiveness of the vaccine. And as a result as well, I'm 100% comfortable being around people that are not vaccinated.
And that's the point.
I don't mind.
Personal choice, yeah. It's amazing that we're doing this again, even though the CDC says that it's no longer a health emergency. But here we go again.